It is 10:07 at WPSL 1590, the talk of the Treasure Coast. And you are on Bone Talk with Dr. Joe Wiersbecki.
Hey, good morning, Greg. How are you?
Doing fine. How are you?
Very good, thanks. You just got me today. Dr. Southard is doing some surgery in the hospital, so you and I will be holding down the Bone Talk fort.
There you go. Well, it's not like it hasn't happened before over the last.
Oh yeah, we've done this many times. Yeah, we can handle it just fine.
Hey, I got a question for you. Of course, the big story in college basketball last night was that the number one prospect in the United States, UConn woman basketball player, ACL. And she was coming off of, was it your leg? What's the other one? I get him confused and I shouldn't.
She was a sporting activity, like she was.
Yeah. Oh yeah. She was coming off that injury, and then all of a sudden gets an ACL. And you're just thinking, oh my gosh.
Oh, she was getting over a previous injury.
Yeah.
It's kind of like when Kevin Durant 2 or 3 years ago in the NBA Finals was coming over a calf strain, and then I forget if it was the first or second game back, he tore his Achilles tendon, and then he was out a year and went from there. But yeah, we see that commonly enough that we can put together in theory why one injury made you more likely to have that second injury. And maybe by doing things differently with that first injury, you may have avoided that second injury.
But I know, you and Dr. Ed have had this conversation a million times, and, even going back several years, Rob touched on it a little bit. There's something about women athletes and ACLs.
Yep.
And
yep.
I don't know what it is.
Yep. And there's a number of different things, and the research papers kind of go back and forth on this, and even test questions for physicians, because some people will say that it's related to a woman's period and when they're more likely to get an ACL tear. Women are a little bit more likely just in general to get ACL tears. There are certain sporting exercises, positions, motions that make you more likely to tear your ACL. And then the other one that's commonly tested by us or in our doctor exams is if you have torn your ACL, let's say it's in your right knee, and what's more likely if you're, let's say, a soccer player, are you more likely to re-tear that one that's been repaired, or are you more likely to tear the other knee's ACL just during the course of sporting? Actually, Greg, let's ask you. So if I'm a soccer player playing in high school and I had my right knee ACL repaired and I'm back to playing sports, am I more likely to tear the right knee or the left knee?
Well, I would imagine you favor the right knee a little bit, and that may put a lot more pressure on the left knee.
Yep. So I think the research is ever so slight that you're more likely to re-tear the one that was previously repaired.
Wow. Oh, yep. Wow. That's okay.
And it's tricky. So, and again, this is just statistics, and maybe people don't even care about this, but let's say that you had the ACL tear on your right knee, your chances of tearing the left ACL is higher than the general population. So it's kind of interesting. So someone who's never torn their ACL, they have a much lower chance. And you think, so there is something underlying at play for why some people are more likely to tear either ACL. But once that tissue has been damaged once, it is by far more likely that you are going to damage that tissue again, just because nothing's as good as the way that we're naturally built. Surgery tries to get us as close as possible, but never to where we were before. And there are some common misconceptions. We talk about that movie every now and then. I think it was the Rookie of the Year, where the kid breaks his elbow and he's in a cast. And then after that, his elbow is super tight and he's able to throw 100 miles an hour as like a 12-year-old. And some people believe that you come back stronger. And it's a misconception, of course. The few injuries where you come back stronger is if you're building up a bone. And of course, we've talked about this on Bone Talk a number of times, like those MMA, UFC fighters, how they'll do repetitive kind of hits to their mid calf in order to strengthen up that bone. So that way, when they hit someone or kick someone with that calf bone, that it can withstand that pressure. Bone does come back stronger, but everything else, joints, cartilage, ligaments, tendons, they do not come back anywhere near as strong. And that is as close to medical fact as we have.
Wow, that's amazing. Well, when you start thinking like whether it's basketball, soccer, the lateral movement,
Mhm.
baseball to a certain extent, although there's not all that much. And, and you've talked about it several times, whether it's running backs or wide receivers in football, cutting one direction or the other. It's those lateral movements sometime are not that natural to the body.
Yeah, and really when you break it down, what it actually is it's an unpredictable movement, a very quick, unpredictable movement. So the classic example is you trying to juke someone out and fake them out. The motion is so quick that your brain isn't pre-planning this. It is something that you're doing so quick that your brain doesn't have a time to stabilize with the other muscular forces of that joint. And it's that very quick, unexpected motion. That's when you're most likely to tear it. Now that, or some kind of big trauma like a 300-pound offensive lineman falling on your knee, of course, that can tear and break anything. But the ones that are non-traumatic, it's a very quick motion. So you may be watching a basketball player and he's about to juke someone out. That's going to be it right there when they go down with their knee. If you're, let's say that, and I forget what it's called, maybe the 3-point stance or that defensive stance in basketball, and you're just traveling along with them in that same lateral motion, that one's not so much as likely to bother your knee or to injure it, but it's the quick juke. That's it.
Yeah,
Yeah.
well, that makes perfect sense because, all of a sudden the knee just jets out one way when it's been going the other way. Yeah, I get that.
Wait, what happened? Like nothing happened. Those are the ones that are suspicious for an ACL tear or something more major. It's when it almost looks like nothing happened at all. They're just moving, they're changing position really quick, and then the player's down in writhing pain. That's where it was right there. And it seems so silly. Like, how can our body not handle that? But it's a pretty extreme, quick force that you're putting through that joint.
Well, and as I mentioned several times, having a lot of friends who played in the NFL, I think the worst invention of all was the plastic turf. And when they get all of a sudden when they get the cleats caught in a seam, I mean that's usually devastating injury time.
Yeah, yeah, and there are definitely more injuries that are happening related to the turf. You got turf toe, for example, something that's named directly after it. Uh, it's been a while since I've looked at some of those studies. What's most likely, we really tend to look a lot more at those when you're in heavy research related to that body part. But for me, whether someone comes in and they have an injury from a natural field or from a turf, it doesn't really help to add much benefit to the diagnostic process of saying, you tore your ACL or your medial collateral ligament or your tendon. That's not something we consider as much because it's not useful diagnostic information, but it's more useful for policymakers and for people who are trying to train in a certain way and avoid injury. Some of those bigger statistics help them.
Are there any studies out there, or is it maybe just too new? I know, like if you go down to St. Thomas Aquinas High School, they've got artificial turf. Boca Raton has got artificial turf. Um, are there any studies of like kids who've, basically grown up on artificial turf and then wind up playing it in college and then maybe play it sometimes in the NFL? Are there any studies about those kinds of people?
I wouldn't be surprised if there is, because that'd be a pretty easy research project to come together with. And I'm guessing what it would see, and I think you're kind of hinting at, is it's the sudden shock, it's the sudden change in what the athlete and the body is not used to, that you're more likely to have an injury. Uh, you want to do what you've been used to your whole life. For example, we get into this topic. So in answer to your question, I'm not aware of the study, but if there was a study, I would bet that it would show if that kid was used to playing on grass fields their entire life, uh, and then let's say professional level, they switched to, you compare two groups, two kids or two groups, one group that has always been on grass their whole life and plays only in grass in pros, and then the other group plays grass their whole life and then they play in a turf in pros. I'm guessing you are much more likely to see injuries in that group that changed to turf later on.
Yeah.
And I bet that would be something statistically significant. So, what do you do with that information? Well, I think you need to plan for the unpredictable. Right now, you don't just play on concrete, or you don't just play on grass. You kind of mix it up so that way your body is used to everything. This is a topic that comes up with running medicine, because a lot of people will say barefoot running is best. And they try and force everyone into doing only barefoot running. But their whole life, maybe their parents were putting shoes on them since they were 1 year old, and they never walked barefoot at all. Now, what's probably naturally better for us is to really use a minimalist shoe and really minimize shoes our entire life. But for those people, and I tried it, I tried going from me wearing a lot of shoes to wearing a more minimalist barefoot type things, and you just cause injuries. Your body cannot get used to it. It's very difficult when you're talking about 10, 20 plus years of doing things a certain way. And even if you go slow over the course of, let's say a year, I mean, still that's a pretty small amount of time compared to how long your body has gotten used to this. So I think it's very difficult. What is ideal is probably something, like I was mentioning, where you're using more of a minimalist shoe, but trying to force someone into that, it's just a near impossibility outside of certain scenarios, and then you take certain precautions. But yeah, long-winded answer to your question.
Well, and in a way, if you really look at like what Nike did with whatever those Air shoes, their running shoe is, it's very, very light. And so, I would imagine, of course, I've never been a long distance runner, but that, and they utilize those shoes. Now they go through them a lot, because, if you run 20 miles a week or 30 miles, something like that, you're going to go through a set of shoes and nothing flat.
Yep. And it's good, this kind of movement that we have towards less bulky shoes. You don't want to be in a shoe that is too high, too much like a platform shoe. It's too much weight. It's not good for you outside of, certain people who have, let's say neuropathy or some other kind of terrible arthritis problem, that they need that kind of footwear almost as like a brace in order to treat an underlying condition. So, and same thing. I think Dr. Southard said it a week or two ago. It's good that we're getting away from using as many dress shoes. It'd be great if, men were using less and less dress shoes. Dress shoes are terrible for the feet and for your knees, for your ankle, for your back. What's even worse than that is women's heels. It may be a while longer before women abandon the heels. Guys, I think we're pretty quick to abandon the dress shoe.
Oh yeah, there's no doubt about it. But speaking of shoes, I think just in my case, um, New Balance for me, it's a little bit heavier shoe, and it helps my ankles for some reason, and I don't know why, but it's been like that I've been a New Balance person uh, since I was a teenager, and it's just, I don't know whether it's a balance issue or what it is.
Yeah, New Balance is a good product. If I remember right, they're one of the few shoes that the insole, that cushion that's built with it, is removable. I don't think it requires like a shoemaker to take out the natural or to take out that pre-made insole. Because if you have if a shoe came with certain insole, you don't want to put a Dr. Scholl's or whatever on top of that, or a custom insert on top of that. That's not as ideal as taking out whatever they gave you, having a nice flat surface, and then putting in the proper insole that's better fit to your foot. That's more proper. Now, every now and then someone can get away with stacking them, but in general, I tend to like New Balance's strategy where you can remove it and put it back in.
Yeah, they've always worked for me. I'm wearing them today, and you are right about, boy, it has probably been, well, it was a formal dinner up at ESPN on our anniversary, 40th anniversary. I'm guessing that's what, 2019. So that's the last time I think I really had, as I jokingly call them, hard shoes on.
Yeah. Yep. I hate wearing them. So yeah, if you have the choice, obviously it's better for your feet, for your body to have a more comfy shoe on and not clug around those dress shoes.
Now, okay, your wife is a doctor. Does she wear high heels a lot or no?
But special occasions, but at work, let's say 95% of her shoes are a tennis shoe. At work, she wears like I think it's and I'm seeing this brand gain popularity. It's the OC tennis shoe. I don't know how you say it.
Yeah. I've seen the commercials.
It looks like a really nice tennis shoe, and it's kind of like a black on black, blue on blue. So it's not flashy. And so it can double as like a type of dress shoe. You see the guys on ESPN all the time wearing something similar. It's nothing flashy, and from afar it looks like it's just like a black or a standard color dress shoe. So I like that, and especially my wife, being up and down all day as a dentist. She's been through 2 pregnancies now, and all that does to your feet. Yet the tennis shoe has been great for her.
Well, I got to ask you, how are the little ones doing?
Oh, they're doing great. Eating great, sleeping great. Every now and then one will wake up in the middle of the night, but that's pretty rare. So we're happy for it. I think my patients are happy for it because I'm not coming in sleepy ever. I don't know how some other doctors do it when their little ones are not sleeping well and then have to go perform in a very high mental functioning requiring state, physically and mentally. Doctoring takes a lot out of you. Yeah, it's nothing physical like a construction worker, but being up and down and doing the kind of things that we have to do, you need your body and mind rested to properly do a good job in medicine.
Well, and let's get real here. I mean, when you're in an operating room at 6:30 in the morning or something, I mean, you've got to be pretty sharp.
Oh yeah. I mean, even take someone like Dr. Forrester, who's operating on the hand. If he's got a little bit of a jitter because he didn't sleep well enough the night before, or if his back is thrown out, or he's got a neck problem, he's not going to be able to perform as well. Same thing with Dr. Powers, who's operating on hips and knees. They're really tugging on the body and on the joints. They're using heavy duty hammers, saws. They're very expensive medical hammer and saws. It takes a lot out of you.
Yeah, there's no doubt about it. And it's it's amazing. I don't know how you guys function sometimes, because you look at surgeries, and I don't care what the discipline is, it seems like they always stack them really early in the morning. Yeah, I don't know the reason for that, but it seems like that's always the way it is.
Yeah, that's a good point. Maybe part of it is patient driven because they have to be what's called NPO at midnight, meaning you can't eat anything after midnight. And that doesn't matter if your surgery is at 6 in the morning or noon. That's just the standard medical practice of saying you can't eat anything after midnight. And I think a lot of people, they want to get to that first meal, even if it means, that their surgery is that much earlier in the day. I don't know, us Americans, we don't like to fast.
Gee, what a surprise. Yeah. And if you're Italian, that's even worse.
Yeah. So I got this list sent to me the other day of common myths in orthopedics that the general population more or less believes. And so I'm going to put you on the spot here, and we'll let you be our guinea pig. So the first one here is that carpal tunnel is only caused by excessive computer use.
All right. The magic word there is only.
Exactly, exactly. So that's why that one's a myth, because it's commonly caused by computer use because of the way that you're putting pressure on that part of the wrist. Um, and that can decrease blood flow to the carpal tunnel. And then that can cause damage. It can cause scar tissue, which pinches up against that carpal tunnel nerve. But you don't have to, people who've never been on a computer ever in their life can get carpal tunnel. The other common things that we see it is when the wrist is in a chronically abnormal position. So one of the other big culprits of this is if you're sleeping in a position where your wrist is kind of tucked, like all the way fully in, fully flexed or fully extended for a long period of time. And so if the body's in that, if the nerve is in that position for a long period of time, that inflames it, it causes damage, and it causes decreased blood flow. And then you get carpal tunnel after years and years of doing that. That's part why when we treat carpal tunnel, one of the first things that we recommend is that someone wear a wrist brace at night, because then their wrist stays nice and straight at night, and they're not going to cut off blood flow and pinch the nerve by putting it in those abnormal positions for long periods of time.
Ooh,
So
I like that. That's a great idea.
Yep. Yeah. All right. You're one for one. All right. All right. How about tennis elbow and golfer's elbow are due to tennis and golfing?
Hmm. Um, hmm. Interesting. Not necessarily. I mean, in theory, like Tommy John surgery, that could be a baseball. I mean, that's a baseball injury, but I would imagine quarterbacks can have something like that.
Yep.
Um, I, I I wouldn't say just those two sports.
Yep. Exactly. So so we do this a lot in medicine for some reason. A person's name has to be tagged onto a diagnosis, like Tommy John surgery, or if something is extremely common in a certain population, then medicine has just deemed this medical condition. We give it the alternate name of something like tennis elbow or golfer's elbow. So let's take tennis elbow for example. Tennis players, they do that backhand with their tennis racket. And in order to do the backhand, you have to squeeze the racket really hard, the handle really hard, and you're kind of doing that backwards motion. And when you're doing that a lot, you're activating a lot of your gripper muscles and then a lot of the muscles to help you do the backhand. And those tendons attach to that outside bone in your elbow. Now, that's not the only time that you perform these actions. If you're doing a lot of gripping, if you're doing a lot of typing, if you're wringing things out, if you're turning a screwdriver, you can also activate these same group of muscles. So when we give it the name like this, it's really just because we tend to see it with a higher percentage of this population. But anyone who uses their hands can develop tennis elbow or golfer's elbow. We talk about it a lot in the knees. I'm often telling patients, hey, I mentioned this diagnosis to you, but if you ever want to Google it really quick, you just search this. And one of the more common things with the knee is something called runner's knee. And so, of course, runners get it more often. And this is just a layman's term for tendonitis and kneecap issues in your knee. So if you have a kneecap cartilage inflammation or kneecap tendonitis, a lot of people call that runner's knee. And so, yeah, back to the original thing here. Anyone can get that. You don't have to be a tennis. You don't have to be a tennis player. You don't have to be a golfer to get golfer's elbow. You don't have to be a runner to get runner's knee. And it happens so often that someone's in my office and I tell them this is what you have. And they want to say, whoa, stop everything. I'm not a tennis player. I can't be that. The diagnosis must be wrong. And so we have to kind of get ahead of this and explain, no, it's just more common in this population.
Yeah. And of course, golf, wow, that puts pressure on so many different joints in your body. If you do it right, I mean, your hips, your knees, I mean, your back. I mean, you name it.
And you're right, the back especially, and it's so funny to me, several times a week, I'll have a golfer come in who is golfing many times a week. And they're coming in with maybe it's something atypical, like some leg numbness or some calf cramping, or maybe it's some hip pain. And they are flat out surprised that I'm saying that their pain is related to their back and they've never had a back problem. You're a golfer. All golfers have a back problem. It's lucky for you if you're not feeling it, but golf is terrible for the back. It is a lot of very quick motion, quick forces going through the low back. Just ask Tiger Woods or any other person who's been golfing a very long time. Every golfers get back issues. I mean, there's fancy mechanical ways of pointing this out, but you got to have a good posture. You got to be careful with the way that you're golfing and that you're not overdoing it. And you should be doing a preventative exercise program to help to combat against some of these bad changes that golf is doing to your back. If you're an active yoga person and you stretch before you golf, you are much less likely to have a back issue or to develop a lot of back pain compared to someone who's not doing those things. So if you're a golfer, please do a preventative exercise program.
Well, and that's, I think you folks over the last 15 years have talked about stretching before. And I don't care what the exercise is before anything.
Yep. You're exactly right. It's what do you see the pro athletes doing? And there's so much up-to-date research and technology and intelligent thinking behind the majority of the athletes' program. If you watch an NBA Finals game, what do you see all the guys doing ahead of time? You see them stretching, you see them doing the rehab program before the game starts. And so, and these are genetically gifted athletes of the highest level, and you see them doing this. What makes you think, if you're just a common everyday golfer, you're not exercising, you're not doing anything ahead of time before your sporting activity, why do you think that you're going to avoid injury? What makes you so special or lucky? You need to be doing these things, and you need to have even better compliance than the professional does if you want to avoid injury, because these guys are genetically gifted working with nutritionists and high-level trainers. Everyone needs to be doing this. We should all be physically active, and before you are physically active, you should do some kind of a warm-up program to help avoid injury. And hey, if you haven't had injury yet, great, but it's coming. Sorry.
Yeah, and that's not necessarily a couple beers in the country club restaurant.
Yep, like that. What do they call it? The 12-ounce curl, right?
Yes.
I'm up right here with my beer, the 12-ounce curl. I love
that. Yeah, great exercise.
Yep.
Oh boy,
Greg, you're doing good so far on the myths. All right, so now we got to turn up the heat here. So the statement is, if you can move a body part, you don't have a fracture. So is this true or false? If you can move a body part, you don't have a fracture.
I would say that's true.
False.
Really?
Yep. So you can have a fracture and be able to move that joint properly. Absolutely. So let's take one example. A compression fracture in your back. We see it all the time that a person will have an acute injury, and they'll come into my office. They'll have pretty good motion. They'll have pain in the back, and boom, there's a fracture. Or take a stress fracture. Someone could be running and putting a lot of pressure through their calf bones, called your tibia and your fibula, and they come in and they're able to move their ankle and their knee, but they do have, and they're able to put pressure on their leg, but they have pain, but they can move it, and they have a fracture. Fractures are really funny, and they don't all behave exactly how they should be. You would think that if you have a fracture that you're going to feel it right then, whenever that moment happened when you broke the bone, but that's not necessarily true. Like I said, a stress fracture, you could have just a slowly worsening pain, and that bone is slowly breaking. Or maybe, you think you dropped something on your foot, you're not sure, but you're moving around pretty good with some pain, you could have a fracture in that area. Now, again, that's just, this is the black and white of do you have a fracture or not. Most often, if you're able to move in a pain-free way, and part of the key to this is, do you have pain? If you're able to move a joint normally and you don't have any pain, 99.999% chance you don't have a fracture. I've seen maybe a handful of fractures over the years where the only subtle finding that they had that there was a fracture building was some swelling, some mild swelling that was just not getting better. But yeah, for the most part, so it is an incorrect statement. If you can move a body part, you don't have a fracture. Interesting, huh?
Yeah, well, that in a way that does make sense. I know I had several conversations with Bill Walton, who obviously his career was cut short because he had some tiny bones in his feet
Yep.
that were very problematic and never really healed. And finally, it forced him into retirement. I mean, he could walk okay, but his days of playing basketball were really, really shortened. And you've talked about it. The foot has so many small bones in it, and of course, we're putting all that pressure on it.
Yep. Yao Ming, the same thing happened to him. He was very tall, just like Bill Walton, very athletic. And sometimes if you don't have the right portion size of bones and joints, then you can be more prone to stress fractures and early arthritis in a certain joint. And those can be very difficult to come back from, when you start to develop these stress fractures. And when your body is built in just a slightly abnormal way and you're putting a lot of forces through it. And it happens. And it is what it is. And with current medicine and orthopedics, the way it's at, there's certain limits, but yeah, you're right.
What's very interesting to me is, and you see it a lot with volleyball players and basketball players too, because they're doing heavy duty jumping. And that puts pressure on obviously everything from knees all the way down to feet.
Yep. Yep. All right, Greg, we'll test you here if you've actually been listening these past few years, because I've given the answer to this one a few times. So the statement is cracking knuckles will cause arthritis. So if you're cracking your finger knuckles, from the time that you're a teenager through adult, are you more likely to have arthritis because you are cracking your knuckles a lot?
Our daughter used to do that, and I used to tell her she was going to get arthritis. Oh boy, that's one of those
Yep, all or none. So the answer is no. There is no evidence that cracking your knuckles makes you more likely to have arthritis. There's no evidence that cracking your knuckles causes arthritis. Now, it may be true. People have tried to study this and they haven't come up with a definitive answer. And even people have looked on big population studies. Have you been cracking your knuckles your whole life, and looking at a picture of their x-ray of their hand, comparing, to a group of people who never crack their knuckles. And so with our current medical information, cracking your knuckles does not cause arthritis. The same thing with people in their knees. They may say my knees have cracked ever since I've squatted low my entire life. That's just a noise that certain people's bodies make. It is not causing any arthritis, and it is okay. The cracking joints, the popping joints, it doesn't mean anything bad. Now, from just an etiquette standpoint, a lot of parents and just people in general don't want you cracking your knuckles. And so I think sometimes just because they don't want you doing these things, they tell you that it's going to cause something bad. So I think maybe that's where it gets its bad reputation. But yeah, you can rest comfortable knowing that cracking your knuckles does not cause arthritis.
Yeah, guilty as charged. I'm there with that set of parents.
All right, Greg, how about this one? You should ice immediately after an injury. If you injure your ankle, you should ice it as soon as you can. You injure your neck, you should ice it as soon as you can.
Well, when I was pitching, I mean, I was icing literally when I got off the field. I would say, yeah.
Yep, that one is true. If you think you injured something, well, inflammation is going to build. Anytime there is an injury, part of what gives you pain and tells you you have an injury is the body putting inflammation there. And it's serving many scientific biochemical purposes on why it's sending inflammation there. But if you have too much inflammation, that's not a good thing. So if you think you injured something, put ice on it afterwards. That kind of goes back to this timeless question that people ask me every single day, and that's okay. Is heat or is ice better? And the classic way that we approach this right now, and with the best of our medical information, the best answer we have is if you treat your injury like a pitcher treats his shoulder, or you treat your pain like a pitcher treats his shoulder. So before activity, he puts heat on it. He warms it up. You want to get heat to a joint before the activity. Heat before activity, and then after the activity, you ice it. Now, so that's with any kind of pain. Obviously, if you broke your leg, you're not going to try and use it, so you're just going to use ice for that. But if you have a chronic shoulder pain and you have to go out and paint a house or throw the ball with your kids, yep, you do heat before that activity. And when you're done, you ice it to reduce the inflammation that you caused from that activity. Now, if someone has a chronic back pain, it's a little bit different. You know, if we're just talking about pain management for a chronic pain, do what feels best. Most people are going to respond better to heat for a chronic pain. Some people will respond better to ice. And what I tell my patients is the body is funny and that it responds to pain by the extremes of the temperature spectrum. So a lot of heat tends to help reduce pain and inflammation. A lot of ice tends to help reduce pain and inflammation. So whichever one feels better to you is the right answer, because ultimately, if we're dealing with a chronic pain, we're just trying to reduce your symptoms. We're trying to reduce the pain. Don't worry about which one is supposed to be better if it's a chronic pain. And again, most of my patients with arthritis related issues, they tend to do better with heat.
Well, and I know you really helped out when I got into that accident situation, and you were treating me for the what was it? Soft tissue is what you called it, injury. And you know, the TENS unit worked great on that during, you know, the few weeks that it took to get better.
Yep, absolutely. TENS unit is a good non-surgical treatment that physical therapists would teach you how to use. You could probably watch some YouTube videos too and get a $20 to $50 TENS unit on Amazon, for example. And it helps to reduce inflammation. It helps to mobilize fluid. It helps to reduce some of the nerve response. So you don't have as much pain. And again, if anyone wants to give us a call live on air, the number for Bone Talk, 340-1590, 340-1590. And of course, if you want to come and see me at Florida Orthopedic Specialists, give us a call at 772-335-4770, 772-335-4770. And again, I have the office in Stewart and the office in Port St. Lucie.
And you're in Stewart today, right?
Yep, I'm in Stewart today covering the walk-in clinic. So no patients walking in with injuries during the show. So that's always nice.
That's a good sign. Yes. Oh boy. Yeah. So were you
how about this one? Young people do not require total joint replacements. Young people don't get total joint replacements.
I would say
that
under the age of
50, 55, you don't get a joint replacement.
I would say that would be highly unusual when a young person got one. I mean, whether it's trauma or whatever it is.
Yep, you're right. So young people can sometimes get a total joint replacement. We prefer not to, but there's certain times where a disease process or a medication side effect or a severe injury has significantly damaged the joint, and really that's their best choice. So, and again, we prefer not to have to do this, but it's all about quality of life. And if this joint is severely damaged, then it sometimes needs this level of attention. Uh, so every now and then I'll see a person who was maybe in the ICU or who had cancer treatment. And as part of that treatment or being in the ICU, they were on high strength steroids. I mean, we're talking really high doses, not like a Medrol dose pack. And when you're on too high of a dose of steroids for too long of a period of time, it can damage a joint. And the most commonly damaged joint is going to be your hip joint. So I think it was maybe a month or two ago, I saw a young guy who had lung cancer treatment, and as part of that high dose steroid, it completely destroyed his hip joint. And he was maybe 30 years old, and he had to get a hip replacement. I've seen it also someone be in like a motor vehicle accident and significantly dislocate or damage their hip, and sometimes they'll require a hip replacement from that. Same thing with the knees and these young athletes. You know, if you've had multiple knee surgeries and knee injuries, then you can sometimes need a total joint replacement. So, yeah, there you go.
Yeah, well, you hear some of these awful stories of, kids in college that are coming off like 2 or 3 major surgeries, I would call. Of course, every surgery is major to me. I mean, just it's just the nature of it. But boy, you just think, what are their bodies going to be like when they're 40 or 50 or 60?
Exactly. And if they're young, they have a lot of living to do, which is part why they're getting the surgery, because the joint is holding them back from living as fully as they want. And yeah, you may be robbing Peter to pay Paul. And yes, when you're young, you're going to wear out a total joint replacement sooner than if you're older. It's just a fact of life. 40-year-olds are more active than 50-year-olds. 50-year-olds are more active than 60-year-olds. And so the later on you get that joint replacement, the more likely it is that it's going to last you for the rest of your life. And that's ideally what we want. But if you're 40 years old and you just can't do anything because you have terrible pain in your hip or knee, well, you deal with that problem later on if you do end up wearing out that replaced hip. And luckily, there are revision surgeries that can be done. They have some risks, but who knows where we're going to be at, where the world is going to be in 15 years from now when you may need that joint replacement. Something could, the world could end today, or maybe medical science rapidly advances and the revision surgery is a piece of cake 15 years from now when you may need that revision. But, like I was saying, and me being the non-surgical specialist, the injection specialist, we want to try and maximize conservative non-surgical treatments. That's why I'm here, telling people, hey, you have a good chance of rehab and success if you were to do physical therapy or getting this shot of cortisone or the stem cell treatment or whatever it is. And I'm honest with my patients. I'll have some people come and see me for bone-on-bone arthritis in the knee, and they're asking about the gel shot, and they're hoping to get really excellent results. And I'm saying, look, the shot, it may give you you have a 70% chance of success. Or if we're talking about a cortisone shot in their hip or a certain condition, I'll say, look, this is a 50-50 chance that the cortisone is going to help you, and I'll lay it out for you. And everything in medicine and heck in life is a lot of percentages. And me being a mathematician, I think it helps. We can't guarantee anything. We can't guarantee a success with a surgery or a shot. But let's tell you your percentages. That way you can have a realistic idea of what you can expect.
Stem cells, are they going to finally come about? Yeah, I mean, stem cell research and stuff that will be kind of an everyday activity.
Eventually, it's going to be. And if I had to guess, when is it going to be that the success rate is so high that your everyday average socioeconomic status person is doing it for pain, like we are for cortisone? It's probably going to be 15, 20 years would be my guess. It's advancing, and eventually I think it will be. Even more so, I think there may be something else that's non-stem cell related that eventually answers the arthritis question and helps to, in a way, cure arthritis. I think that's coming our way in the next 15 to 20 years, that we're going to have a better treatment than what the insurance companies currently offer, that will help to more long-term treat arthritis. I think it's better than a 50-50 chance in the next 20 years that we have some kind of long-term definitive shot to help treat arthritis. I think it's coming. There's some people getting pretty close with some interesting ideas.
Well, speaking of interesting ideas, I was reading Twitter last night, and I was thinking of you guys going all the way back to the early days of Rob Sellers talking about travel baseball. And the dear doctor from Birmingham, Alabama, who was I guess outside of Dr. Curlin or Dr. Job, the big baseball people, go to this doctor, and he just blasted travel ball. It was like I'll tell you, he unloaded last night on how unhealthy. And he said he didn't care what the sport was. Well, it was baseball, basketball, whatever it was. He said, your kids need a break. And you guys have been preaching that for the last 15 years.
Yep. And really, it doesn't matter what you're doing. If you are, if you're a painter, you need to take time to rest your shoulder, whether it's overnight or you're taking a vacation or whatever. If you are a golfer, you need to take time to rest your back and rehab. You cannot be doing this year round. People are even starting to show this on the smaller scale, everyday things. At work, there's a reason why you have a lunch break. You should be turning your brain off, allowing it to kind of recover in a way. Same thing if you're at a gym, doing a bench press. You just can't do bench presses, for 30 minutes. You need to take breaks in between to give your body a chance to recover. And I think you can hear some of these coincidental stories and put it together with some of the research that's out there. I mentioned taking a lunch break, shutting your brain down over a lunch break, meditating, going for a walk. That's going to help your brain to be fresher for the afternoon. Heck, the Europeans, they do their siesta or whatever to turn the brain off. Same thing with orthopedics and the traveling ball. You just have to. Otherwise, you're at an increased risk for problems. And it's good that Dr. Southard probably isn't here today, because Dr. Southard, he takes his sports pretty intense, especially his lacrosse. And he can tell you what that parent mentality is like. He really speaks to that. He wants to be successful. He wants his athletes to be successful in lacrosse. And so, you think, how do you get success? How do you stack that in your favor? Well, you do more of that activity. If you want to be a better surgeon, you do more surgeries. But what the real life evidence says is only to a point, and then it's detrimental. So, with travel ball, we don't recommend it. An athlete needs an off season. And the examples that we use are someone like Russell Wilson or Kyler Murray. They took an off season from football and they did something else. They played baseball or whatever else.
Yeah. And it makes perfect sense because you use different muscles.
Yep. Use different muscles in a different way. And yeah, if they're too similar, then you have a problem. And I could see some people arguing and saying, well, you're throwing the ball, you could still be damaging the shoulder. Yes, but you throw the ball in a different way. And you're just to a different level, to a different intensity, a different volume. It's in a different way. So
yeah.
We don't want to tell athletes, they just have to go and read a book in the off season, that we know that's never going to happen. So I think this is a nice way to kind of compromise. Don't go and play travel baseball. Instead, go and play football or go and play basketball. The athletes, they like to be active. And so I think it's a good compromise, and we'll see what ends up happening with that. But I think all doctors are really on board with this compromise that we have.
Yep. And like I say, Dr. Andrews, if anybody's on Twitter, look at Dr. Andrews' feed from last night, because it was bombs away. Oh, he just, Yeah, it's basically the same thing you said, but he was really, really strong, and obviously the compressed tweet message to parents. Period. No travel ball, and the fact that he had seen apparently an unusually high number of kids this summer with terrible injuries, and so that I guess was the gist of his tweet. But yeah, it's amazing. Of course, the guy that I think really and truly amazed me was the athlete closest that I knew to Superman, and that was Bo Jackson.
Oh yeah, that's what I say. Yep, he was the closest to as genetically gifted Superman as they come. Yep, it's Bo
Yep.
Jackson.
Yeah, and no matter which sport it was, he was number one in it. There's no doubt about it. But there again, the very, very unusual breed of athlete. There's no doubt about it.
Greg, are there any current pro athletes that are playing multiple pro sports? In the same season? I don't think there's any current, are there?
I don't think that that I know of, at least that are in the major leagues.
Like I hear about them training with other pro sports teams, or they've been drafted and they technically have rights to them. I've heard about that, but as far as a pro athlete playing in an official game in one sport and playing an official game in another sport, I don't know the last time it's been done.
Yeah,
I mean, Dion comes to mind, but I'm sure someone more recent.
There you go. That would be about the most recent that I know. And where do we find you, doctor?
Yep. Oh yeah, that's right. We're running out of time. So I'm Dr. Joe Wiersbicki, and I'm with Florida Orthopedic Specialists. The website is drw.org, doctorw.org. That's also where you can find my wife's information too. And again, Florida Orthopedic Specialists, we have the one spot here in Stewart off of Highway 1 and Willoughby, which is just a little bit west of Highway 1 and Indian Street. And we have the office in Port St. Lucie off of Highway 1 and Walton Road. And the telephone number for us is 772-335-4770, 772-335-4770.
All right. Have a good week, doctor.
All right. See you next week.
You've been listening to Bone Talk right here on WPSL, Port St. Lucie.